or you want some clarification about our services, just give us a call. 780-424-2424.
Thanks, Tanya, for bringing us all this great information today. And I know some people might have some follow-up. Have a great afternoon. Questions, and they can reach out to you or to us to facilitate, and we'll happily get more information, because this is such a life-saving program in our city, and I just want everyone to know about it. So thank you for bringing this information to us.
Yeah, absolutely. We love talking about it. We're here to help, so that's why.
Yeah.
Right. Thanks so much.
Okay.
All right. Well, welcome to everybody who has joined us already. I'm sure there'll be people who will be coming in over the next few minutes. That's okay. They can jump in. We're going to be talking today about Access 24/7, the services that we provide, who we are, how you can reach us, and how we can support individuals and loved ones of individuals who are struggling with mental health crisis, questions and concerns around mental health. My name is Tanya Anderson. I'm a psychologist with the program. I'm the clinical supervisor here at Access 24/7. I have been with this program in its many iterations for the last 13 years, and I've had the privilege of working with a number of individuals who's accessed our services. And I'm here today with Lauralee.
Hi everyone, I'm Lauralee. I'm a peer support worker here at Access 24/7, and I've been here pretty well since the beginning of our program.
Okay, so for those of you who may have questions as we're going along, I think probably what will work best is for us to go through all the information that we have arranged for us to share with you. I know we have an hour here for this session, and the information that we've set up definitely will not take us the whole hour, so we'll have plenty of time for questions at the end. People can ask questions through the chat, and we can respond to them so that everybody can hear what the question is, and then also maybe learn a little bit more about the program that we haven't talked about. If anyone has any separate questions, we'll talk about how to access our program Access 24/7 at the end. And if you have any questions about specific situations or specific individuals, then you can definitely contact our program at any time. So our program serves the Edmonton and area for Alberta. We are part of Alberta Health Services, addiction and mental health team. Go, get this going. With Access 24/7, our main population that we serve is the adult population, so 18 plus. We will definitely have resources and information for people under the age of 18, and we'll be able to direct those individuals and families to the services that are best suited to meet those needs. Our doors, we go from 18 all the way up until really 100 plus. So we service that whole adult population. Our services are for individuals who are looking for information, support, ideas about how to manage mental health, people who might be in a crisis or looking to get connected to services, and also for those people who are surrounding individuals who may need that support, so family, friends, other professionals that are involved in the individual's care, different community agencies contact us. We've had neighbors, landlords, really anyone who's concerned about an individual who may be struggling with some concerns with their mental health. Our doors and our phone lines are open to anybody who has any questions about mental health. The staff that we have working with us is a huge range of experiences and professional backgrounds. So we have mental health therapists. These include psychologists, social workers, occupational therapists. We have registered nurses, registered psychiatric nurses, addiction counselors, social work at various different levels. We have psychiatrists that work with us, so part of our clinic is a psychiatry clinic. We also have a pharmacist that's on our team who can answer questions about medications, how they work, how best to take and use our medications. And we also have some really great resources with our peer support workers and our family peer support. And I'll let Lauralee talk about those for a little bit.
Yeah, so as a peer support worker, I share my lived experience in mental health and addictions. We offer additional non-clinical support through mutuality. We connect with clients to help them feel safe, understood, and engaged. We can provide education with resources as we are able to share our own experience with these resources, for example, treatment, therapy, support groups, and many more. We are examples of recovery to inspire hope, model wellness, and how we handle the stressors and coping of everyday life through our mental health and addictions challenges. We show people that the road to wellness, even with its challenges, is achievable and worth the effort and hard work. For family peer support, they basically do the same thing, but to support the families who have loved ones who are experiencing their own mental health or addictions or challenges. And they are there to also give resources to friends and family about how they can best be supported while supporting a loved one.
Yeah, and it was an addition to our team when we became Access 24/7, and we've definitely seen the benefits of having this perspective on our team. So that's who we are as Access 24/7. We're quite a diverse team. We have individuals with a number of experiences, and allows us to draw on different perspectives and really work to support the individuals who are looking to gain that information, support, and connection to services in different ways. So what do we do? What are we? What can we offer? We have a number of ways that we support individuals and community members. So first of all, we have all kinds of information that we can share about mental health services, Alberta Health Services, community services, general information about mental health, mental wellness, how to manage some of the struggles with life. We have the ability to connect people with ongoing services and supports related to addictions and mental health, and to support individuals and families who are trying to navigate through the system. We know that it's not always easy. It's not a clear-cut path from where you are to where you want to be, or where you really need to end up. So we try to help people navigate that, and I think Lauralee and our family and peer support workers are really helpful with that process as well. We provide consultation to professionals in the community. We provide mental health assessments in the form of intake assessments, assessments to help determine what exactly is going on with individuals and how can we support them in the best way possible. We can conduct interventions from a mental health perspective and look at those beginning stages of treatment, helping people to get to where they need to be to continue their wellness journey and their road to recovery. Part of our team is crisis outreach, and we also have a stabilization side, and we'll talk about those in a little bit more detail. So with our intake services, we have, part of Access 24/7 was to look at how do we get people to the right door. So we decided to create a door that people can walk through, and no matter if they want to be connected to services within Edmonton, within one of the communities surrounding Edmonton, they didn't have to be shuffled from one place to another place to another place. we can welcome them here and connect them to the clinic that's going to best suit their needs, or the place that's going to best suit their needs. So with our intake team, people, our staff, our therapists, our social workers, our addiction counselors are trained in gathering the information that's required in order to get a picture about what's going to be helpful. So we had a question here: what do you mean assessments to determine where people are at? When we do our assessments, we're looking at what people are hoping to achieve with their goal to wellness, what concerns they have with their mental health at the current time, what situational factors they might be dealing with that's impacting their mental health and wellness, and how do all of those aspects all combine together to see where the person is at right now in terms of what they want, in terms of help and support, and how we can best get them those services and get them connected to the people that can help and support along that journey. With the Alberta Health Services Addiction and Mental Health clinics, we have access to individuals who are trained mental health therapists. So this is all covered by Alberta Health Services, and people can go for therapy, for treatment for their mental health concerns, for if they've been diagnosed or not. People don't have to have an official diagnosis to be connected to services. And we also have services around addiction specifically for individuals who really, that is their goal, that is what they're looking to get support with. We can make that happen and get them connected to the best place that's going to suit their needs. Sometimes people contact our service and we do that intake assessment, we talk to them, and we realize that really there's some really great community agencies that might be able to provide some of the services that they're looking for, whether it be groups, support groups, information around parenting, information around cultural support services. And so our therapists and staff have knowledge about some of the community services as well. An example would be Momentum or the Canadian Mental Health Association. We often will refer to the Family Center as well, that has some groups around parenting and couples communication. So the intake piece is really about how do we get people to the best place for them. Then we have our crisis support side. So with our team, our professionals, therapists are trained in helping intervene with individuals who are in a moment where things in their life aren't working the way that they want them to, and they feel like they're in crisis and that they need that immediate support and intervention. That looks different based on each individual's needs. Sometimes we provide ongoing phone support to individuals. We see people in person. We can connect them to ongoing services again. Sometimes what individuals need is really just some support and direction. And that's another piece that our staff are always looking to integrate into the treatment plan. Mm-hmm. Part of our crisis support team is also our peer and family support, family peer support workers. And I'll let Lauralee talk a little bit about how they support us with individuals who walk into our clinic.
So a lot of times, typically, someone will come in when they are in crisis and they need to speak to someone, and their families will bring them in or come to support them. And we recognize that these family members are also having challenges dealing with their loved ones' addiction or mental health challenges. And they need a little bit of support too, right? They need to maybe find out if there is like a parenting group that they can attend. A lot of times there are a lot of support groups for parents, family members, friends, to be able to lean on each other and to really be able to share their experiences and know that they're not alone. It's just as important to us to support the families as it is to support the clients here at Access 24/7.
Yeah, we know that individuals live within a system,
Right.
and that often it includes family members, and family doesn't have to be blood relative either. Lots of people have family members who are their chosen family,
Yeah.
which may be friends or longtime connections that they've had. And so family doesn't have to just be those blood relatives.
That's right. Yeah, family can be like any sort of support that is being given to a client when they come to see us, whether it's a friend, a longtime person that they've known, family members. They all kind of encompass that, and they all are appropriate to see a family peer support worker and to feel supported and to have that person that they can talk to about resources or about what they're going through and kind of share that lived mutuality with also having a loved one that is in need of support.
Yeah, we just had a question about that with how do you ensure confidentiality when it's a family and friend and so on. We work within the confines of the Health Information Act and FOIP, of course, always respecting the individual's privacy and confidentiality.
Mm-hmm.
And so if an individual has decided that they want family or friends to be part of their care, they can consent to information being shared or not.
Mm-hmm.
When there isn't that sharing available and that consent hasn't happened, then we can still provide support to the family, giving them education on how to support someone in general terms who's struggling with mental health concerns
Mm-hmm.
or addictions concerns, and giving them resources that they can follow up on, whether it be groups, support groups, online information, articles, books, giving them the support in that more general way.
Mm-hmm. And typically as well, when a family or a supporting member comes in with their loved one, typically a family support worker will wait until that client is being seen to approach the family so that there is that confidentiality, and so that the family or friend or supporting person feels comfortable and able to talk. If there isn't very much chance or like a big time window for them to talk, a family peer will introduce themselves and pass out a card and let them know that if they are seeking support for themselves, that they can feel free to call and speak to a family peer.
Thanks, Lauralee.
Yeah, no problem.
So part of what we look at in terms of how do we support people in the moment is one part of our team is called stabilization.
So yeah, that's why. I just couldn't remember if you.
Someone has their mic on there, so we're just getting a little bit of extra.
I've never done it, but I feel like I just need to bite the bullet and do it. I don't know why I'm having apprehension about it. I think because there was just a lot of issues right when I came back into PACT with like Laura and the one officer. But I think it actually be good because I think I'd be a little bit less busy than PACT, and PACT is like unmanageable at times. So I'm happy to do our
Okay. If someone has their mic on, if they could turn it off, that would be great. So with the crisis support, when people come in and they're immediately in crisis, sometimes they can't wait for a week or 2 weeks or 3 weeks or 4 weeks to get into the clinic of their choice.
Mm-hmm.
So we have something called our stabilization support services. And what this means is that we have immediate access to mental health therapists, addiction counselors, social work support, physician support with our psychiatrists, and our pharmacist and our peer support workers. So what can happen is we can book appointments with people within a few days to continue on with that crisis support to really stabilize a person where they're at. Our goal is to get people the help that they need where they're most comfortable, and not to have have people wait and wait and wait till maybe the crisis is past or it's gotten worse until they get those services. If we are able to book someone in with one of the mental health clinics for ongoing services, and it's a 3-week wait, then our team can stay involved and continue with that support, that short-term counseling piece, the addiction intervention piece. And also some basic services with our social workers. So we know that individuals' mental health can struggle more when they're struggling with basic life challenges around housing, trying to figure out and navigate Alberta Works, trying to navigate some of the basic need services that we have, and our social workers are very well versed in understanding those systems and can help our clients navigate that as well, so that we can support from different sides and really look at the person as a whole. And again, with our peer support, having that lived experience, being able to understand what it's like to walk through those systems.
Yeah, so at Access 24/7, I see people who have presented to the clinic as a walk-in or after someone has called in for support or to get initiated with services. My colleagues work with me to help clients get connected to a peer support worker through referrals after speaking to a client who is seeking mental health or addiction support. I connect with clients in our clinic, the community, at home, over the phone, and we strive to give people the support they need as individuals wherever they may be in their wellness journey. A good example of that would be I had worked with a lady who didn't really have very much hope when it came to working with Alberta Health Services and like the health system. She had some experiences that just weren't the greatest for her, and wasn't really feeling engaged in services, but she knew that she needed the help. And so I kind of stepped in to support her and to show her and give her examples of myself also feeling the same way in the past, and having just the courage to move on and to meet with these supports and to talk with them and be honest with them, and not to worry if maybe someone who's supporting you doesn't click with you. You don't have to feel stuck. You can ask, can I talk to someone else? Can I see someone else? Like maybe that you're just not feeling compatible, and that's okay. And she ended up becoming a part of our stabilization program, and then moving on to see a mental health therapist in the community. And as far as I know, is doing quite well now. So that's just one example of what I do here to help the stabilization process. Yeah.
It's really nice I'm a psychologist, and have had my own mental health journey as well, but people don't always want to hear about from a professional about how tough it is to navigate the system. And so having the support from our peer support workers and our family peer support workers who they've lived it and that they can share it from that really personal experience is quite nice.
Yeah.
One question here we have with COVID: how has this changed Access 24/7? Well, like with everybody, we've had numerous changes. When you see us in person, we have our masks on, and we We manage the social distancing as best as we can. We use PPE when we need to. We haven't turned anybody away. If people need services, we find a way to provide those services, whether that be over the telephone, through Zoom with some of our doctors, with connecting people in, having larger spaces so that we can really space out. And navigating some of the limitations that we've had around COVID. We've still had people coming into our clinic. We've had lots and lots of contact over the phone. For a time, we did limit some of our community visits, but when people were in need and we needed to see them face to face, we went out and we took our PPE and we made it happen. So it's, COVID has impacted everybody, and we've definitely seen an increase in people calling with anxiety due to the COVID and the changes, with people concerned about social isolation and not having access to their regular support system, social supports and professional supports. It's it's definitely something that we've seen in terms of increasing stressors in people's mental health.
Yeah. Definitely. And we also provide PPE for anyone coming into the clinic as well, hand sanitizer. We've been screening people that come into the clinic. And like Tanya said, we're not turning anyone away. We're just figuring out how we can best support the client in the circumstances that we are in with COVID.
Okay. We also I mentioned we have psychiatrists who work with our team. So we have psychiatrists, a number of different ones that will see our clients and will consult with our professionals, our mental therapists, our nurses, our social workers, and our addiction counselors. People have, been referred here by their family doctors to see a psychiatrist for a consultation. Our psychiatrists don't take people on as ongoing patients, so they don't carry a caseload here at Access 24/7. When an individual comes in and they see one of our psychiatrists, it's typically a 1, maybe 2 time visit, and then the care is transferred to an ongoing provider, maybe back to their family doctor, or to, if they have found a psychiatrist that is taking them on for ongoing treatment, then that care is transferred over. What happens with someone who might be interested in seeing a psychiatrist is that first they'll need to speak with one of our therapists and share some of the concerns that they have going on, the reasons they think it might be helpful to see a psychiatrist. And after that intake assessment, if we determine that, yeah, absolutely, that would be some great value added, some great support, then we make that happen. And we're lucky that we have psychiatrists available to us on fairly short notice, not always same day, but usually pretty quickly. Not everyone who comes in needs to see a psychiatrist. Sometimes their needs are better met with another professional or another service, and we make those connections happen. We just had a question. What if they already have a psychiatrist, but they're not available for their client in the crisis? For people who are in crisis, we make sure their needs are met however we need to do that. So whether that's a mental health therapist, addiction counselor, peer support, whatever services need to be put in, we make that happen. Typically our psychiatrists, if it's not a crisis and someone already has a psychiatrist, we'll refer them back to their ongoing treatment provider, their ongoing psychiatrist. Our psychiatrists don't typically see people for second opinions, for example. But if it is a crisis, then we do what we need to do to make sure that we can support and resolve the crisis in the best way possible, with all of our professionals, including our psychiatrists. So here's a look at what you what would happen when you contact our services. So you contact us, whether by phone, in person, and the staff who is your first point of contact will ask a whole bunch of questions about what brought you to our service today, or what led you to call if you're concerned about somebody else, what the situation is, what's going on, if there's any risk factors, if people are connected already. And that helps us really think through how can we best support them in the moment. So we want to match the person's need right now with the best service that we have available. So this might include support over the phone. Lots of people call. We have almost all of our interactions over the phone or in person. We have our walk-in clinic, and this is also 24 hours a day. So people can come in. We also go out to see people in the community. So if individuals can't or don't want to or aren't able to get in to see us and they need something face-to-face, then we go out. We see people in their homes, in their communities. I've talked to people on sidewalks, and really our goal is to get to where people need to be. Not everyone is mobile. Not everybody can come into our service. So if we think that face-to-face is really important, we make that happen. It might be a one-time contact. It might be ongoing contact. So there might be short-term follow-up, a little bit longer-term follow-up, connection to services, perhaps a referral to an Alberta Health Services clinic, as I've talked about, connection to our stabilization team, as I've talked about, discussion about those community supports that might be in addition to, or something might suit their needs even better than an Alberta Health Services service. And sometimes people call or come in and what they're really just looking for is information. We can provide that and encourage them to call back if they need anything else. We have a question here saying there are a lot of communities who are looking for support. Does 24/7 have counselors and psychiatrists that speak other languages? Yes, we have some psychiatrists and counselors who speak other languages. It's a bit limited right now, but we're lucky enough to have access to a language support line. So whether people are calling in or coming in person, we can contact the line where they can find someone who is able to interpret the language that's required, and we can provide services that way. What about individuals who have trouble initiating the call? Have you considered going online live to decrease the barrier to access? At this time, we haven't considered online services. I know that there are some online crisis support services available in the community already. That's not something that we're looking at in the immediate future, although we know things change all the time, and with technology that there's always those changes happening. We often will be asked to reach out to people. So loved ones, community supports might call in and say, hey, can you call this person? They're nervous about calling. Can you guys reach out? Absolutely, we do that all the time. So going back, it looks like we have a couple questions here about teens and youth. I touched on this at the beginning, but for those of you who might have missed it, we are primarily an adult service, so 18 and over. We will absolutely support individuals in the transitional youth age who are experiencing crisis, so 16, 17, 18. And we also work closely with the teams that are aimed specifically at teens and children. So there is a crisis response team for children and adolescents. There's Access Open Minds, which is a drop-in program for that transitional youth. And we will work together with them again to meet the needs of that age population as best as possible. Do we take PDD clients too? Yes, we do. Yeah, we again will look at what the needs are and how to connect them to services that are going to support them as best as we can. We don't have any exclusion criteria around individuals who have pervasive developmental disabilities or any really type of challenges in terms of learning or cognition. We look at addiction, mental health, functioning, situational crisis, and we don't have all the answers, but we try to find the best answers that we can for our clients. Do you have anything else to add?
I don't think so.
Not right now?
No.
Okay. I think I've caught up on most of the questions here. So it really brings us to where do you access us? I mentioned a couple times, we are 24 hours a day, 7 days a week. We don't shut down, we don't close our doors, we don't turn off our phones. Our phone number is 780-424-2424, and that's a number that can be shared with anybody. Individuals looking for services, individuals wanting information about services, or those concerned about other people can call us at any time. We are located, our physical clinic, our walk-in clinic is located in Anderson Hall. The address at Anderson Hall is 10959 102 Street. And this is located right next to the Royal Alexandra Emergency Department. So we're basically across the street and just a couple doors to the south from the Emergency Department at the Royal Alexandra. And again, our walk-in is 24 hours a day as well. So we have mental health therapists working 24 hours a day. There's a little map that's just come up on the PowerPoint presentation, little red box. Over here is Anderson Hall, where we are. And the emergency department is just up to the north of us. So across the street and just down is where you will find us here. And we're also in the community. So again, I mentioned going into people's homes, doing visits in the community. Some people, they don't really want to come into a clinic, but they also, for whatever reason, don't want us where they're residing. And so they've asked that we can meet at a neutral location, which is absolutely, as long as it's a safe place where we can have some confidentiality and privacy, we make that happen to meet the clients where they're at. We are Edmonton and area, so we don't go too far outside of Edmonton, but we do go to some of the surrounding communities as well, as people need, and we have clinics that we connect people to in the suburban areas. Another question has come up here. What is our relationship with the homeless population? Many of our clients struggle with homelessness. We welcome individuals who are in that population. We have a lot of them who come in for that interim crisis support. We work together with the inner city agencies, and we don't have access to housing per se, but as I mentioned before, we have our amazing social workers who really know the best ways to navigate that system and looking at the challenge with homelessness. Another question here, will the connection with the client happen right away or will it go to voicemail? How large is our team? Our team, it varies based on time of day, how many staff members we have working. We have a very large number of calls coming into our service, and quite a few people walking in now that some of the COVID restrictions have lifted. And so sometimes there might be a bit of a wait. We do try to answer as many calls live as we can. Sometimes people do leave messages, and we return those messages as soon as we can, ideally within pretty short time frames. But yes, we have we sometimes can't answer all the calls that are coming in. We would encourage people to call back or to wait for that call back. We return every message, every voicemail message that we receive.
Mhm.
Yeah.
Yeah.
Yeah. Is there any other questions, things we haven't talked about? People are interested in with our team? Do we book right away with a clinic? Yes, we do. So if someone calls in, say they've been struggling with issues around anxiety and have found that it's starting to impact their life and how they function, and that they're isolating more and finding it more difficult to function, and they really want to look at getting some support and some counseling around that, they can call in. We will go through that intake screen, try to figure out what's going to be the best service to match them to, and then right in that moment we can look at booking them into the best matched clinic within Alberta Health Services, if that's going to be the service that's going to best meet their needs.
Mhm.
Yeah. Are there some clinics or AHS programs that you don't have access to for immediate booking? Yes, we don't have access across the board in addiction and mental health, but the majority of the clinics, the 108 Street Clinic, the Northgate Clinic, East Edmonton Clinic, a few other clinics and programs, we have immediate access for booking, including Hope and Wellness, which has some really good groups as well, so for support. Another question, what is our intoxication policy if someone is in psychosis and intoxicated? So we have, again, we have an open door policy. We make sure that safety for the clients accessing our services is put as one of our top needs, and the safety for our staff. So we don't have a blanket policy that people can't show up here intoxicated. We have people here under the influence multiple times that I've seen individuals and clients. And we really look at how can we, again, support them. And I've said this a couple times, where they're at. So in their use, in their presentation, what can we do in that moment? How can we follow up with them? And if there is some safety concerns, then we look at how we can manage and address that as well.
Yeah. Just as long as everybody's safe.
Just as long as everybody's safe.
Yeah.
Yeah. What are some examples of the type of therapy used? Oh, that's a pretty big question. So here with our therapists, really, because we are more short term, we use a lot of short-term intervention therapies. So motivational interviewing, cognitive behavioral, solution focused, a lot of psychoeducation. Some therapists will use narrative therapy. We have lots of different therapists that are trained in different modalities, but those are some of the more common ones that we use. So, and we use a lot of, really, it's about engagement. It's about trying to build a relationship, trying to really listen and try to focus on the person in their journey. Yeah. These have all been great questions. I haven't seen any others pop up necessarily. Oh, individuals with severe trauma can be referred out to trauma-focused therapy. Yeah, we can refer out to mental health therapists who have some experience in trauma-focused therapy. A lot of our therapists also have some extra training in understanding how trauma affects people and in their experiences and in their mental health and in their overall view of the world. So we definitely have done work around trauma-informed care. Yeah. Is Access 24/7 a good place to bring someone who is suicidal, or are there recommendations for suicidal cases? Absolutely, Access 24/7 is a good resource for someone who's suicidal. whether it's calling in and asking how we can support. Maybe we come out to you, or whether the person comes in to see us here. That is a great example of someone who's in a crisis, who's potentially experiencing suicidal or self-harm thoughts, and is looking for that immediate support from a mental health professional.
Yeah.
Yeah. And this is also where our family peer support and our peer support workers can also come in to be supports for individuals who are maybe nervous about accessing services or what it's going to look like.
Yeah, and just, you know, be able to share like the mutuality of feeling like you're in crisis, or, you know, having suicidal thoughts, or any type of case really, and just, you know, letting that person know, like, I have been here before, and I can just imagine what you may be feeling right now, and that, you know, we can help you get through this, and this is what we can do to help you along the way in your journey, so that, you know, that just some people think that they have these experiences and they're kind of stuck with that, and like they feel like it's never gonna go away, or this happened, this is like these are feelings that I've had come up for me, and so this is how it will always be. And I can sit down with clients, or family peers can sit down with families and say, like, you know, this is what I did to come out of where I once was, and that, you know, things can move on and eventually, you know, get better, as long as that's what you're looking for. We will help support you in any way possible to keep on going in your wellness.
Yeah. And crisis doesn't have to mean suicidal or self-harm.
No.
Sometimes it just is, you know, you don't know what else to do or where to turn. You can't shut your brain off, and you feel like nothing is right in your world. That is a valid crisis that we have people contact us for all the time as well.
Yeah.
Yeah. And other times crisis is that an individual has, you know, been going through their journey with their mental health and their mental illness, and things have gotten off of the path that they want to be on.
Right.
And they found that their symptoms have gotten worse, and it's turned into that crisis where they want to get back on track. If you see the client is connected to another program, will you collaborate with them within AHS? Yes, absolutely. Yeah, we don't want to reinvent the wheel. We don't want to start again at the beginning. So if people are connected already, that is going to be one of our first pieces that we're going to look at to get people back connected with, to make sure that we're all on the same page and supporting the individual in their wellness journey. Anything else from anyone? I haven't seen anything else pop up here. All right, well, I'd like to thank everybody for your great questions. And if something does come up down the line,
you too.
bye now.
Bye.